Hope you can hear me well so far.
Yes, we can hear you.
Perfect, great. Yeah, thanks a lot, Sabina, and the whole team for inviting me, for having me here. It's not only a pleasure, it's an honor to be presenter today here. I have 50 minutes, so I try to make it quick. So let's share my slides with you. And here we go. All right. Well, yeah. So I want to highlight actually COVID-19 in relation to UN development. And here I bring in a critical point of view. So you were mentioning the title of today's talk, that what is actually UN development doing in terms of, or with regard to COVID-19. This is a point I want to talk about, but as well, I also want to point to a bit before, to the SDGs, which were adopted in 2015, in order to show also that there's also the other way around, to think that we can talk about what's the role of UN development in the occurrence of COVID-19. Two aspects I want to highlight. Let's start. I will start with 2015. You may notice this is long before the outbreak of COVID-19, but like I said, there are connections to the pandemic. Then I want to focus on the Human Development Perspectives report, which was published last year in May 2020 by United Nations Development Programme, UNDP, with a particular focus on COVID-19. And then as a third source, I want to go to the Human Development Report, which was published in December 2020, which was actually planned before the outbreak of COVID-19 already, in the light of 30 years Human Development Report published by the Development Programme. But yet, of course, now with the influence of COVID-19, which I will also present here in this 15 minutes. So it's quite a big outline, so let's start. And let's start with transforming our world, which is the resolution of the UN Agenda 2030, in which the SDGs are the main part, to frame it briefly. So what we see here is that in this political declaration, which comes before the goals, that we have already this first mentioning of, we envisage a world free of disease, a very broad message here. What we can see is that United Nations are creating an illusion of an unattainable ideal. So a world free of disease, I think it's quite unrealistic, but it's a political goal. So it's named here. You have to think about 193 member states deciding on this resolution. So this is the first goal they set, and then they become a bit clearer afterwards. We will equally accelerate the pace of progress made in fighting epidemics. So what we see here is a belief in agency, so that we, as let's put it very broad, the world society, here in the case of the United Nations, the political leaders of 193 countries, that they believe in their power and their agency. And then there is a particular goal, SDG 3, which is focusing on health and well-being. And there we have this clear message: by 2030, end the epidemics. So what we see here is that on a medium-term range, there's the will to eradicate fully the epidemics. 2030, sorry, is the end of the SDGs, like 15 years long running goals, which were adopted 2015, like I said, and in 2030, they should be achieved. So that's what we see. Let's have a more closer look into this goal number 3. Like I said, I put this quote here. I will read it out briefly. It says, support the research and development of vaccines and medicines, provide access to affordable essential medicines and vaccines in accordance with the Doha Declaration on the TRIPS Agreement and public health, which affirms the right of developing countries, and in particular provide access to medicines for all. So what we see here is that there are references to other political documents like the Doha Declaration, the TRIPS Agreement. So it's a lot about intellectual property rights, which is a big issue when it comes to vaccines, what we see clearly right now in these days. And what we see here already 2015, that the state community is recognizing sort of unequal power relations in the world between the states. So this is something which is set already 2015, like I said. When we have a look to nowadays, I want to briefly use this as the foil to to see how it works now. And we have here the campaign which was launched last year by the World Health Organization. Probably most of you are familiar with it, the Access to COVID-19 Tools Act Accelerator campaign, which is maybe better known, the one pillar of it, the COVAX initiative, the organization, the COVID-19 Vaccines Global Access Organization. So with the goal of equal and just access to COVID-19 vaccines worldwide. So, and let's see what happened. So now, almost 1 year later, we see the first vaccines are delivered to Ghana and Ivory Coast. You see the numbers, 600,000 and 500,000, so 1.1 million. We have now the first delivered. When you think about a world population of 7-point-something billion, then this is quite a small number, to be fair. Then when we look at the budget, so there was 38 billion euros were budgeted for this project, and until now there are still 27.2 billion missing. So this is a clear sign that majority of planned or budgeted money is still missing in this project. And of course, the role is here hinted at the states. So the states are not paying the money they were saying they give to this initiative. What we also see is that there are already a lot of corona vaccine doses ordered by states worldwide. So if you count this to the adult population in the world, then every person could be vaccinated twice, which is right now. That's where we are already. What we see is that there are certain states which have ordered between 0.5 shot per citizen. I named some of them here, you can see. And at the other side of the medal, we have 10 countries using 75% of the world's vaccines so far. So, which means that more than 130 countries have not yet received one single dose. So this is the state, the current state, a highly unequal distribution. Let's go to this Human Development Perspectives report. What we see here is that the United Nations Development Program were giving some outlooks based on simulation and projections, how the Human Development Index will be in terms of COVID-19 crisis. So they were publishing this in May last year, which is quite early in the crisis. We are much further, but we will see this with the second report in a minute. Here, just to have a focus on the three main areas of the Human Development Index, which is income, education, and health. And I added poverty as the main legitimization of development at the United Nations level. So let's see the numbers. So we have a projected 4% drop in gross national income per capita worldwide, almost 9 in 10 students out of school, death toll over 300,000. You probably know the numbers where we are now. So this in May last year is quite low in comparison where we are unfortunately now. And when we look at extreme poverty, it's an increase by 40 to 60 million. So this was already a quite negative outlook. And when we see now the 30 years of human development reporting and the index, that there is an increased drop at the end. This simulation, what they did, the researchers at the United Nations Development Program, shows that there's an immense drop of development, if we can phrase it as one term, but how it is calculated here. So this was what we could learn in May last year. So let's, and of course, this is something we shouldn't forget, that it's highly unequally distributed. So with vulnerable groups, much more affected by this. So UNDP, they were already mentioning in May that it needs to look through an equity lens to support who are most affected, and with this, the vulnerable groups. So now in December, a couple of months ago, we had the Human Development Report 2020, a report full of crises. When you read it, you will see they talk about from the financial crisis, the climate crisis, inequality crisis, and you see the others I named here. So it's quite a shocking report. At the same time, they try to highlight chances and opportunities. To see now here again these 4 fields I was presenting right before from the report, which was published a couple of months before. Here we see income. There were no numbers, but in Germany it was higher than expected on the worldwide level, almost 1% more drop of income. Then education. Just 2 days ago, UNICEF published this report where they were showing that 168 million of children are already for a whole year out of school. So we see already that maybe the discussions we can follow in Germany or in Europe are not only slightly, they're quite different to other world regions. And you see here now the number that we are already over 2.5 million people who died in a direct relation to COVID-19. And poverty is now at 100 million people. So also these numbers are much higher than what I presented from the other report. What we also see is that in this report, they acknowledge also that academics, basically, they were forewarning that a pandemic like this will come because of what they phrase here, the pressure people put on planet Earth. So this is recognizing this influence, and also especially with the focus on ecosystems and the spill out of viruses here. And I want to go into this because this brings us in the end back to the SDGs, to the starting point. So what is missing is that these reports, they name, okay, there was this pressure by humans, but they don't really put emphasis on structural causes. So for example, overexploitation of nature by deforestation, stealing, you know, when they build a lot of new living areas and put a lot of asphalt everywhere, monoculture cultivation for food production, for livestock, and so on and so on, you can name it. So there are a lot of structures which are connected to consumption and production patterns. And this is not only an issue which is, when you think about illegal deforestation in the Amazon, this is always linked to also consumption, let's say, for example, in Europe. So the main slogan of the report is expanding human development, easing planetary pressures. So, and this is something new which is coming in. At first, they say, okay, we want to go on in a way we were thinking before, like more human development is something that is to achieve, and then this in the limits of the planet, broadly speaking. So another expression is here, the increasing transmission of disease from wildlife to humans reflect the pressure we are putting on the planet. So you see, again, it's a bit of downplaying, I named it here. So the wildlife, because humans maybe are eating wildlife, that's maybe a problem. But what is not really mentioned here is that the whole production system, like the whole structure of production, is part of this outbreak also. So that's one point we see which is missing here. And to come back now to the end, to the SDGs, we still have the one goal, more economic growth. And this is what we see in the main slogan in the first part, the expanding human development. And we also have the SDG 9, more industrialization, more infrastructure. And yes, they were placing now the word sustainable economic growth, sustainable industrialization, sustainable infrastructure. But at the end, there's still a quantitative more. So that's the problem in this. So with these infos we could get from the reports and the SDGs, I want to highlight 5 points of food for thought in the end. So COVID-19 has clearly led to an acceleration of global inequalities, something which was going on already before, but this was a clear boost. Second, the crisis is multifaceted, which means that when we look at the global age structure, again, like discussions like in Europe about health are not everywhere the most important, because there are more people in younger ages and they face much more economic and social consequences of this COVID-19 crisis. Third, the crisis is directly related to the consumption and production patterns of the world population. Again, here we see social structural differences between different groups. Fourth, no equitable distribution of vaccines can be organized at the United Nations level so far. That's what we can see. I mentioned the budgeting, I mentioned the distribution, and so far there's no change, or let's say like sufficient change to see. Fifth, UN development still involves status maintaining aspects that will lead to further crises. I know it's quite a negative outlook in the end, But if, to put it bluntly, if these goals remain in the agenda of the UN development, then this is not the last big crisis we will see, unfortunately. With this, I'm at the end, and I want to say thank you for listening to me.
Thank you so much, Albert, for your wonderful presentation and highlighting on the UN Human Development Index report. And we see that there has been an immense drop on the indicators like health indicator, education indicators, health and poverty indicators. So with this, we'll move on to our presentation from our next speaker. Our next speaker is Mr. Tharjan. He is from Bhutan, and I'd like to share my slide. So talking about Mr. Tharjan, he is currently the Executive Director at Center for Local Governance and Research. He served as a member of parliament representing Thorongsa, Central Bhutan in Upper House of the Parliament of Bhutan. As an MP, he served as chairman for Public Account Committee and Good Governance Committee of the Parliament. He is also a special selected member to review education, hydropower, agriculture, employment, and tourism policies in the country. Currently, as a founder of Center for Local Governance, he is engaged in capacity building and research activities in local governments. He will be presenting on impact of the COVID-19 pandemic on the SDGs and local governance issues. With this, I would like to welcome Mr. Tharjan for his presentation. Mr. Tharjan, are you there?
The microphone.
I think you are, yeah. Hello, Tharjan.
The microphone.
Hello. Can you hear me, Mr. Tharjan? Hello, Tharjan. We can't hear you. Yeah. Yeah, I think you are muted, Mr. Tharjan. Still, we can't hear you. Maybe you should check the audio system there.
War-related person practices is a very important issue. It was affected by the crisis, especially the behavior of the people caused by the fear of the pandemic, the fear to attempt activities outdoor, the fear to accomplish the normal and common activities in the life. And health service access, this is a very affected aspect of the determinants of work health, because all of health sector is advocated to attend the crisis, to front the crisis provoked by the COVID. And the other aspect of the health are normally not taken care in the same measure that the COVID expects. So this is the introduction to talk about four very punctualized problems that are related with the COVID and women. The first aspect is about teleworking. Teleworking was a very, very expected way of work by the most part of the women, because in many times was discussed the teleworking like a solution for the working women. One of the most important changes in the COVID-19 pandemic was brought about being accelerated changes in the workplace from office to homes. Although this is a process that was taking place gradually throughout the world, although it was much more frequently in developing countries than in developing ones. With the arrival of the COVID, ground in teleworking up to 3 times have been promoted according to ILO estimates. But we were not prepared for this exponential growth. We have no evidence of a lack of legislation applicable to teleworkers in many countries and huge training failures. These factors are aggravated by a contingent teleworking has not been prepared, but emerges an alternative to continue working and comply with the condition of social quarantine. So these new teleworkers have not been prepared for that situation. They have not agreed with this condition with their employers, and they don't have, in most of parts, optimal working condition for this modality. They don't have adequate equipment like work chairs, desks, computer equipment, high-speed data connection, and other conditions especially designed for teleworking. This last factor is aggravated by the stop in the schools and daycare centers where the woman must take care of the children and other domestic chores while teleworking. Okay, so it's very important to understand the opinion was raised by some universities about the teleworking women. Some of the most relevant evidence we have the opinions about teleworking are resumed in this graphic. One says that the report lack of sleep, okay? This is a very important problem because it's potentiating the fatigue. The most important problem reported by the women in teleworking are the disbalanced laboral family life. This is very important because the teleworking implies a disruption in the familiar life, and the office is in home and the home is not in office. This is very important. We are studying this phenomena in depth, but the preliminary results points about the discomfort of the woman about this issue. The other question is the reinforced domestic role. Okay, the woman feels that the teleworking is more time in home, more time with the children, more time to attempt the domestic task. The other opinion is about the loss of visibility or participation in the laboral issues, okay, in the company. The teleworkers are less considered about the decision making in the companies than the presential ones, okay? And this is added to the question of the women are less taken in account when the decision making in the companies. The other issue is the lack of social support. For the woman is very important, the social support at the work, okay? And the isolation generated by the teleworking is affecting negatively the social support necessary to maintain the psychosocial health of many women. To teleworking is considered suitable for women so far as could help them to reconcile work and family life. The truth is that many women are reluctant to adopt teleworking because they consider that it contributes to reinforcing their domestic work in home and the situation we're living during the crisis. Okay, this is one issue. The other issue we want to be civilized in that conversatory is the health workers. We have in this room to Mrs. Gwen Brackman, the chair of the Scientific Committee of ICO in Occupational Health for Health Workers. A salutation, Gwen. This is a very important issue because a very important charge in the pandemic is attributed to the working woman, especially the healthcare woman. And the pandemic is affecting in health workers, especially to women. We have very clear evidence of that situation in the United States. More than 3/4 of the infected health workers are female. And the situation is the same in the case of Spain, and is need to be the same in the case of Italy. So this is very important situation for women around the world, and this is explaining in the other fact because the health sector is highly feminized sector of the economy. Okay, but it's not only about the infection, the problem is related with other aspects related to the work, and especially about the long work shift, the lack of personal and domestic tasks, the lack of sleep. That is the same impact in the case of the teleworkers, the lack of sleep. More exposure, we've seen in the past slide the special affectation of the woman in this exposure to the COVID. The double workload, because the health workers have an affectation in physical workload at the hospital, combined with the physical workload at home. Physical and psychological fatigue is the result. The other is about stigma. How personal was stigmatized by the community as possible COVID vector. And this social apartheid was very important in most part of the past year, was a very important problem. Some campaigns, information campaigns about that, it was mitigated the problem, but the apartheid was a big problem for health workers, is particularly harmful to mothers. And by other side, the lack of water and hygiene systems is other very important issue. Is in the most countries in the world, the water is a problem, and hand hygiene was made a priority for everyone, and it's placed with little water availability. This means less capacity to supply feminine hygiene. This is a very repetitive situation in most parts that have problem with the water. The other problem I want to visualize in the conversation is about the increasing gender violence. This affects especially to workers, but is a general problem to a woman during the pandemic time. We have, before the crisis produced by the COVID, a very, very severe problem of gender violence, sexual or physical violence, normally by an intimate partner in the past. But with the pandemic, the situation has intensified. The most important factor are the security, health, money warriors, cramped living condition, isolation with abusers, movement restriction, and desert public spaces. This is very linked to the situation in economic areas we go to discuss in the next point. So globally, the sexual harassment and other forms of violence against women continue to occur on the street, in public space, and homes. And the new case of violence is online. Electronic and digital violence is a very emerging phenomenon that we are studying now. Survivors have limited information and awareness about available services and limited access to support services. In some countries, research and effort have been diverted from violence against women response to immediate COVID relief. But this is a very important problem, and in this second wave, the problem has been deep. Okay, we can perform a complete conversatory only in that issue. But to finish, the 4 points I want to discuss in the conversatory is about the vulnerability of the informal and migrant sector during the quarantine. Some facts, more than 74 million women are now working in the informal sector, but with the pandemic, these women are very, very, very vulnerable. And probably we have more people in the informal sector because the quarantines, okay, that has produced a severe consequence on the many countries' economies. And this is the cause for more people go from the poverty to extreme poverty. We have more than 42% of high vulnerability in some sectors, more vulnerability to changes, and the women are more in sector with more vulnerability than men in average. Only 3% of that woman receive support from social security systems. So we are seeing a very important gap of the support of the social security system, because the informality is very difficult to reach support from security system. This is very difficult. Migrant workers are a problem too, because many migrants are forced to move to other countries or return to original country. And we have many migrant corridors produced by the pandemic situation. And this is very, very vulnerable population, because normally is not documented, are illegal, and in many countries are in the informal sector and are in the migrants, and moving probably women, daughters, or sons with no men. The other important cifra is the more than the middle of the informal sector women are violated the quarantine, okay? Because they had to decide die for hungry or die for COVID-19, because the situation is very precarious, and they decide to violate the quarantine, exposing to be infected. And in fact, this population is more okay to be infected by the COVID, okay? We have a very important fact, but this is cost demographic fact about the proper demographic fact that the woman and men, this is the distribution. This is the distribution of the infection in age and sex. And we can see that the infection is the same for both groups. But in the stage of ages, for more than 85 years old, the woman have very, very more affected the man. This is simple. It's because the woman is more aged than the man in that group of ages. Okay, but this need to be the attention, because we need to have special attention to this group of women. Okay, we need to design special health support to that group. Talking about these problems applied to the sustainable development goals, talking about the goal number 1 about the poverty. Well, we are talking about the informality. We are talking about the quarantine and moving to the poverty, to extreme poverty to the people, and the more vulnerable people, that is the group of women, is moving to this extreme poverty more than the group of men. Talking about the goal number 3, goal health and well-being. Well, this is very affected because this is a health situation, but we have the fact I explained to you about the problem in the health sector, more than 3 times for infections in the health sector than men. And women access to sexual and reproductive health services may be disrupted, and as a result, are diverted to respond to a health emergency. So the health system now are advocated to attend the pandemic situation, and other teams in health, very important teams like the sexual and reproductive health, are in the second line. By other side, talking about the goal number 4, the education. The problem is growing in the talking about the woman is in education, and the girls are out of the school, and the closure resulting from the pandemic. But this is the gap of inequity between the and girls. Talking about the goal number 5, the gender equality. This is a emphasis because women and girls are victims of sexual and physical violence, about the factors I was discussing about, and the child marriage are growing up during the pandemic period. That is back in the development of the equity advances we have in the past. About the SDG number 6, clean water and sanitation is very important because the water is a very scarce resource in many countries, and it affects to the women and men in different ways. Talking about the goal number 8, decent work and economic growth, and the pandemic result in precarious employment. More than 10 million women work in the formal economy, what I was saying, and the essential occupation are more in for women than men, because the feminized sector of the economy are education and health and service, the commerce, and this is more vulnerable sector for an infection, okay? And is more vulnerable sector, and the pandemic can affect so social and economic way. Okay, in teaching is very important because education is for that feminist sector. Finally, the SDG 10, inequality is growing up. The inequality between the less developed region and the developed region in terms of the gender indicators. And sustainable citizen community, the population density has risen women and girls participation in the slums, okay? And like a consequence of the deterioration of the poverty, from poverty to extreme poverty, we are seeing a very important growing of the slums, okay? And slums like cities. And the development of gender data, or the data desegregated by gender, is very important to understand this phenomenon and to develop some strategy to front. So let's change. Are many challenges to face this situation, but we are talking of three most important, in my opinion and the opinion of the UN Women. People caring, help for women in caring for people should be strengthened to this important work. Yet must pay, support, must provide working women to have access to these services. Social security coverage is very important. The working woman as mother and supporter of the family must be covered by social security. Mechanisms must be developed to protect them, especially in time of crisis. And better understand that the problem is about the statistics. Disaggregated statistical data by gender allows to better understanding of the magnitude of the different problems and show whether improving or worsening. And many thank you for your attention. This is my contact data, and I will give you that at the end for your questions.
Thank you so much, Igor, for your incredible presentation and bringing up the issues related to women, and also highlighting on this shadow pandemic. Definitely, if you focus our intervention on women, this can be the enabler and accelerator for all the SDGs, including, as you shared, quality education, access to labor market, contributing to poverty reduction, and all the other SDGs. Thank you so much for your presentation. With this, without any further delay, we will move to our next speaker, Mr. Tharchin. I welcome you, Mr. Tharchin, for your presentation. And as a reminder, I would like to ask the audience that if you have any questions for any of the presenters, you can leave it in the chat box, or we can use the raise the hand option and you can share your questions directly to the panelists. So over to you, Tharchin. Thank you so much.
Thank you, Sabina. Good evening to all of you. Now, can you hear me now, right?
Yes, very loud and clear.
Thank you so much. Thank you so much. By the way, I'm attending this conference from rural Bhutan, from my constituency, from my room here in rural Bhutan. So I believe some network hiccups may erupt in the middle of the session. So please bear with me. Anyway, I'll try to focus on the conference content as well. Okay. Thank you for the organizing committee, and I welcome all the participants here, and hi from Bhutan. Before I get into my actual presentation, let me share you that the status of the COVID status here in Bhutan. So far, after detecting our first case on 6th March 2020, so we have 867 confirmed cases, and out of which only 1 active cases. The recovered have almost 865 has been already recovered, and we have only single death so far. So this is the status of the COVID cases that I'm sharing to all of you here. So Sabina, can you share my presentation now? Can you share my slides?
Yeah, I will do it. Yeah.
Okay.
Can you see the screen?
Okay, yes. Now, just for your kind information, I do not have any global statistics or any global data or figure. So I may not be able to share about the COVID impact on SDGs at the global level. But what I'm trying to focus here is on the impact of the COVID on the Sustainable Development Goal purely based on Bhutanese context at the local level. Okay. So next. Yes. Now. Direct to the point, here in Bhutan, we have, as we all know, that COVID has impacted whole world and global level. But in Bhutan, like specifically, we have the COVID, the pandemic has caused a huge unemployment figure rise in unemployment figure. And here's what I want to share. For example, in 2019, we just have 2.7% unemployment figure. Now in 2020, by the end of 2020, we have almost 14% unemployment figure in the country. So it was there's a sharp increase in unemployment figure, right? And second one is if you look at the food import figure here in Bhutan, the rice import figure is almost doubled, is almost increased by 123%. And if you look at the cooking oil import, it has almost doubled. There's 100% increase comparing to 2019. Okay, and similarly we have the livestock products and vegetables, fruits, and all these import figures have sharply risen. So what I mean to say here is that in order to meet the inequality and the poverty return, to have reduced poverty line here in the country, the royal government of Bhutan has ventured, has resorted in the importing the food items, like which has been almost double comparing to the previous year. And the major impact of COVID-19 that we had is on our tourism sector. Now, as you all know, that Bhutan is totally dependent on the tourism industry. Tourism industry is a second earning, the second income generation activity that in the country. So if you look at the figure, the severe impact is on tourism industry, right? So the tourist arrivals has dropped by almost 91%, and the revenue, the direct income or the revenue has been dropped almost by 90.4%. And when the hotels, almost all the hotels get closed, and almost 50,000 plus employees involved in hotel industries, they got impacted. So this is a scenario that we had the COVID impact on our tourism industry, which has been badly hit. And now I think it may take around, 4 to 5 years to recover fully from the COVID pandemic or the impact on our tourism industry in the country. And the fourth one, next. And the fourth, the slide that I want to share you here is about the social issues that Mr. Bilo has been sharing. Similar to that one, there's an increase in domestic violence. The relevant NGO, CSOs, authorities, and the Minister of Health and our health centers, medical centers across the countries, they have recorded the increased number of domestic violence during this pandemic or during this lockdown. And there's a rise in suicide rate. There's a rise in mental health counseling programs as well. There's especially the younger generations. They have become the victims of the mental health problem, and we have developed the counseling programs in the country, and the division or the sections has recorded there's a rise in mental health clients as well. And when it comes to education, this is one of the things that which has been affected badly by the COVID pandemic, and that has directly affected the delivery of quality educations to the students in the country. With the lockdown, with the pandemic, we have twice the national lockdown. So in that way, the whole schools in the country has been shut down. In that way, number one, we do not have a designated or well-developed education in emergency curriculum in place. And number two, the issue here is about the unaffordability of the smartphones. Now, the moment school got closed, the Minister of Education have asked the teachers to go for online classes. And most of the students, most of the parents, they could not afford to have smartphones for their students, for their kids. That also affected the quality delivery of, the quality of education for the students. And the the third reason of affecting the quality delivery of education is about the poor connectivity, because you all know that Bhutan is a mountainous country, and all the different places and different cities has been divided by the very huge hilly mountain areas. So we have partially poor connectivity in the mobile network as well. So that also contributed in the inefficiency in delivery of quality education, online emergency classes. So these are major impacted areas of due to COVID pandemic here in Bhutan. Next. Yeah, now after sharing about the negative impacts of COVID, the pandemic on our different sectors, and I would like to share the few positive impacts as well. Yes, although the pandemic has contributed to rise in the huge unemployment figure in the country, now it has created. I mean, there's a paradigm shift that COVID pandemic also gave us a positive impacts in the field of like employment programs. Now, because of COVID pandemic, the government priorities, government policies have got shifted, and they have come up with the different intervention programs. Now, if you look at the unemployment programs here in Bhutan, we have initiated a Build Bhutan project where the rural youths, where the unemployed youths get skilled, they get trained, they get skilled, and they get re-skilled. So they get employed in different construction sectors and the private sectors in the country. As you all know that Bhutan still depends hugely on the Indian laborers and the expatriate laborers in most of our construction sectors. So the government's priority is now on replacing those expatriate workers through the project called Build Bhutan project. Okay, and we also took initiative to reform our vocational training institute programs. So this is similarly in line with the Bhutan Build project activity as well. And rural government of Bhutan has allocated huge amount in revising and reforming our vocational training institutes about their curriculum, about the structure, about the programs. No, so all these things have been initiated in the country, and reskilling and skilling to replace the foreign workers. This is a part of the thing. The major component is a Build Bhutan, is under Build Bhutan project. So in future, 2-3 years down the line, I think the government is aiming to replace our expected workers as well. So these employment programs is a paradigm shift. There's a positive impact caused by the pandemic. And second thing is about the CSR focus, coordination in small industry focus. Now the rural government of Bhutan has created, they have prioritized the innovations in the small cottage industries, to develop the industries, to have the decent work environment, to have the employment creations, to develop income generations. The government has given special priority focus on the cottage and small industry in development. To do so, the government has initiated a government guaranteed schemes, the lending schemes for the youth who could not afford to lend money from the banks. No, they don't have mortgage and everything. So government has initiated a free mortgaged scheme called the government guaranteed schemes, which means the government will be the security of your loans that you take to develop, to promote any cottage and small industries in the country, especially focus on the rural area. Second thing is about the rural government of Bhutan has also developed a separate or designated CSI bank, which called small cottage industry banks, which directly or which exclusively promotes, aim to give loans for the youths in the rural areas, in the farming sectors, livestock sectors, agriculture sectors, and these are their priorities, right? So number one priority is in that one. The second focus of the CSI bank is about the import substitutions. So as of now, the Bhutan government, we import food items, we import different sorts of technological items, like. So we are encouraging the small cottage industries, youth entrepreneurs to venture into the construction, coming up with the construction materials which we import from other countries to have its own in our own country. And third thing is about the focus on the export. We really need to raise our gross domestic income through the export. As of now, for example, the farming sector, agriculture sector just contributes about 17% of the to the GDP. The government is trying to increase the kind of contribution to the GDP from agriculture sector. So now we are focusing on export as well. Next. And the agriculture sector, I think now starting from first 5-year plan to 12th 5-year plan, our agriculture sector here in Bhutan has been a little bit ignored because when it comes to planning, budget allocations, implementation of the programs, it has been a little ignored. As a result, now during pandemic, we have to depend largely on the food imports that we usually import from Bhutan. Now, if you look at my earlier slides, now you could have seen that the import figure has almost doubled, in 2020 to 2019 to 2020, if you compare this. So this is a bitter lesson that all the citizens learn. Now the government is prioritizing agriculture sector, both marketing, both productions in front. And now, due to pandemic, I think now almost all our tourism industry got shut down, right? And the income that we used to generate from the foreign visitors has been gone down almost to zero. Now that has given an opportunity for the Tourism Council of Bhutan or the Royal Government of Bhutan to more focus on domestic tourism industry. So to have our own Bhutanese travelers traveling around the country, exploring our own culture, exploring our own traditions, different languages, different cultural sites and religious sites. So the domestic tourism promotion is being one of the focus of our tourism council here in Bhutan. And there's a shift in planning and budgeting approach as well from the Royal Government of Bhutan, from the Minister of Finance as well. So as of now, the budget allocation has been totally dependent on the number of populations, the size of that particular constituency. So now there's a shift in budget and planning process, totally based on statistics and based on evidence-based planning. And one of the greatest things that I want to share you here is that about the relief packages implemented by His Majesty from the throne. Like His Majesty has used his own prerogative to help the youth in delivering, for example, when thousands and thousands of youth remain unemployed package for the youth, whereby the youth get employed, and unless they get employed, they have been offered the royal kidu, we call it kidu, is a royal relief package for the youth as well. Number one. Number two is second one is His Majesty's intervention is on the elderly, the vulnerable citizens, the group of vulnerable families. They have been given the rations, food supplies free of cost by His Majesty. And the third thing is about the COVID pandemic has almost affected majority of our elderly citizens. Many of them who are suffering from different sorts of diseases, like they could not afford the medicines. So His Majesty has provided a designated special medicinal package kits for most of the senior citizens in the country. So that has really helped. Okay. And the positive impacts, one thing that I want to share here is about the sense of volunteerism. We have a program called Desung, which is totally under His Majesty's vision, developed by His Majesty's vision. Today we have almost 13,000 Desums. Desums is a young youth, men and women, directly under the command of His Majesty. And they get trained in different areas, the disaster area, health and safety areas, and now they are being trained in the construction of the water system as well. So we have this volunteerism. The sense of volunteerism has been really ignited. The promotions, developments in the communities across the country, and there's a unity as well in the community as well. This pandemic has caused different sectors, different government agencies, NGOs, CSOs, private sectors, youth, local governments, they all come together. So in a way, we have developed a good paradigm shift towards the more unity. And most of the interesting thing is about the communities being resilient. Due to pandemic, I think we cannot get our rations, vegetables, food items on time, right? And our rural communities, they usually depend on their, the indigenous practices. Like they have for example, like the moment they run out of rice, so they go for maize. The moment they go, they run out of vegetables, they go to forest to collect the vegetables. Like so, our rural communities have learned the bitter lessons. Now they are more of resilience, if any, for any pandemic in future. Next. So these are some of the 3 way forwards that I want to put forward here. Now, if in any case that the country may face any pandemic in future, the localization of SDGs is very important. As of now, yes, we have sustainable development goals at the national level, right? And that has really not taken the root or the foundation at the community level. So in that way, the moment we face the pandemic, it is the communities who really get hurt. So now, the way forward that I want to propose here is we really need to localize the SDGs, sustainable goals, at the local community level. Very active participation with the ownership, accountability of our local governments in place, local government institutions in place. So in that way, so for example, in Bhutan, I'm very proud to share that our local governments receives almost 50% of capital funding from the central government. We used to share the 50% of 50-50. 50% of the national budget is being retained by the central government, and 50% of the national budget is directly goes to local government. In that way, our local governments are being financially, they are decentralized, decentralized with the financial authority, now with the administrative authority as well. Hereafter, we are focusing on enhancing the local government capacities through local development grants and training our local government functionaries. So in that way, we really need to localize our SDGs at the community level. In that way, there's evidence-based planning at the community level. So then our health system at the community level become very responsive, and we need to provide quality health system. So these are some of the structural or the policy-based approach that I may like to put forward as a way forward to the all audience for the discussion. Thank you, and Tashi Dile.
Thank you so much, Tharshan, for providing the information on the impacts of SDGs in context of Bhutan. And it's interesting to know about the localization of SDG at the government level. So with this, we are end of all the presentation, and we will move on to the Q&A sessions. I see some of the questions here in the chat box. We will also take questions from the audience. If they are interested, they can use the raise the hand option and throw questions directly to the speakers. So first I see questions. It has been directed to Tharshan, Mr. Tharshan. So the question is, what were the factors for Bhutanese relative success in preventing COVID cases and deaths?
Thank you. Thank you. I will directly share about the achievements, right? Number one, it is the personal initiative from His Majesty's side. From the day Bhutan detected the first COVID cases in the country, His Majesty has alerted. His Majesty has been come forward. His Majesty is at the front line to create awareness to the public. Now this COVID-19 is don't take it easy. This COVID is very serious disease and it's going to affect all of us. So His Majesty has been at the front line, traveling across the countries, reaching out to each and every group of volunteers in the communities, reaching each and every, the local government, forming the local government offices, and His Majesty has formed the COVID task force at the district level, at the regional level, at the national level. So it has been under the number one, it is due to the direct command, the well-coordinated command from His Majesty that has brought the success for Bhutan, number one. And number two, there's a serious public awareness being initiated by the Minister of Health. Number third, I think the Bhutanese people, we really cooperated together in following the COVID protocols, washing our hands, using the mouth masks, keeping distance. No? These are some of the long-term protocols that has been strictly implemented, and the public really cooperated in following these COVID protocols. I think these are the three, out of many, these three really come to my mind about the which has really contributed for the success of COVID cases in Bhutan. Thank you.
So hello.
And final thing I want to share.
Yeah,
final
go
thing,
ahead.
Yeah, we have a prime minister who is a doctor, we have a health minister who is a doctor, and we have a foreign minister who is a doctor, and we have finance minister who came from long year experience in Minister of Health. So we have well coordinated. We have doctors at the helm of the governance. That also contributed in creating and right awareness and taking right decision at the right time. Thank you so much.
Thank you, Tarshan, for responding the questions. So I see another question is directed to Oliver Denk. The question is, why do you think rich states such as Germany do not pay their share to vaccine distribution, or at least what they promised?
Thank you for the question. Well, I would say Germany is doing a lot in terms of financing the international community. So already quite in the beginning of the campaign, they were giving 500 million euros. And 3 weeks ago, there was a decision by the parliament that they give another 1.5 billion to the campaign. So money is not the issue, but there's always another side. There are, of course, questions of intellectual property rights, where BioNTech is quite popular as one of the providers of a vaccine, German-based company. And when we talk about patents and opening them up for wide use, then the state of Germany is clearly against this. So this is one point. And the other thing is, when we look at vaccines which are bought or ordered already, then Germany is also quite active in doing this. And if one state is taking a lot of vaccine doses, others don't have enough, or prices are getting high, so it's more expensive to order them. So this is also a problem. And when we talk about Germany, I think we have already ordered around 140 million doses of vaccines, which is like 2 per person. And there are states like Canada where it's 9 per person. So there are huge inequalities with regard to this as well, when we compare it with the majority of other countries in the world.
Yeah, thank you, Albert. So another questions, maybe it's common to all the speakers. The question is, which single social challenging factors has impacted the SDG the maximum during the pandemic? So maybe we can start with Albert, and then we can go with the other presentations, other speakers, sorry.
Sorry, could you just repeat it? Sorry, I missed the last part.
The question is, which single social challenging factor has impacted the social development goal the maximum during the pandemic?
Yeah, it's hard to say, I would say. Especially, again, when you look both-sided at the SDGs. SDGs as a framework of keeping up with the status quo, but also as the framework, especially later on in the Human Development Reports, as a mean to fight the pandemic. So this is something we should keep in mind. Yeah, so I cannot reduce it to one point, and I really like what Mr. Igor Bello brought in, the aspect of inequality towards certain groups, the example of women, but also I want to highlight that I think what is most needed is to look from an intersectional point of view, that we have to see like the geopolitical position of a person. We have gender issues. We have much more social structural issues when it comes to income, when it comes to location within a country and so on, belonging to a minority group. And I think this is a perspective which has to be strengthened a lot. So I know it's not a clear answer to your question, but yeah, I think that's very important to highlight in this regard.
Yeah, maybe Igor, Igor can add a few comments on this question.
Yes. When we are talking about social impact, it's very interesting because have many approaches. But this is an authentic disruptive episode. Okay, so it have very profound changes in the behavior of the people. Okay, in the behavior in the long-term time, in the behavior in economical, in the behavior in one very important term that is emerging, that is resilience. Okay, we are learning about resilience how to face these disruptive events, about an approach of prevention, okay, preventive approach in all the aspects. In the social aspect, you need to be preventive on the a crisis, have a plan B, or plan C, and plan D, and you need to adjust to behavior to the situation. In the case of the people, particular people, and the case of the organization. We have a very profound impact in organizations, and emerging new ways to organize the management systems, to see the approach of risk. Okay, you need to see the risk produced by pandemic situation, produced by economical crisis, produced by social crisis, and you need to have a very preventive approach. This is for me the more important social change.
Thank you, Igor. Maybe Mr. Tharchin, if you have something to add on.
Yeah, I think the most challenging, social challenging factor that has really contributed for the pandemic here is about the due to lack of gender responsive legislations, planning programs in the country. And number two is about the women and children. When we do not have a designated and inclusive or the programs targeted for women and children, I mean, during such pandemic, I think the most vulnerable sections of the society is of women and children. So any of the country cannot afford to ignore without having a policy in place, without having the targeted interventions in place. So I feel that the most challenging, social challenging factor here is about the lack of gender responsive planning, gender responsive act, I mean the policy, legislation, anything. And second one, the component here is about the women and children. Without having the designated laws, policy interventions for women and children, I think this is two areas that I really find which is very fragile, and because of this pandemic. Thank you so much.
Yeah, thank you so much. Yeah, definitely leaving no one behind is the fundamental cross-cutting features of SDGs, and we should be able to address all the issues of all the groups, including women, children, and other population. Thank you so much. So I say that one of the participants is interested to ask questions to one of the panelists. May I request Gladia to share her questions, and she can unmute herself and share the questions to the presenter.
Yes. Hello?
Yeah, we can hear you.
Yes, thank you. My question is, science education and employment has been affected with this pandemic. How would you consider the professional perspective for the future in terms of competence and progress?
Can you repeat the question, madam?
I write in the chat, since education and employment has been affected with this pandemic, how would you consider the professional perspective for the future in terms of competence and progress?
I start again?
Yes.
Okay. Yeah, thank you very much for this very important question. I think there's a lot of things we can discuss. I would like to focus only on the very last word of your question on progress, because I think this is crucial and essential to talk about this, how the notion of progress brought us as the world society to this status quo. So I think this is something where academia plays a crucial role also in transmitting these ideas of progress, which you can trace back in a historical approach, many centuries, which are influenced also back to colonialism. So this, I think, has to change, definitely. And progress, what is progress? What do we as a world society define as progress? Is it about health and well-being, what we are lacking now in this crisis? or is it about an economic growth, about more infrastructure, more industrialization?
Yeah, Igor and Tharchun, anything to add on?
Yes. Yes. I just want to share that as Madam Gladys rightly pointed out, that education and employment has been the severely affected sectors of the area due to this pandemic. When it comes to education, yes, when the whole schools has got shut down, I think our teachers and the school administrations, they realize that they do not suddenly realize that they do not have the education in emergency plans, how to cater to the children, no, when the teachers are when the teachers are at their own workplace, and when the students are at their own individual houses. So how to connect with this? Online education is a platform. When it comes to online education, the challenges differ from country to country. I mean, as I already pointed out, that in Bhutan, because of the connectivity, because of the mobile network coverage, and we really had severe problems when it comes to education. And when it comes to now, the way forward is that the building up on the professional capacity of our teachers in developing the curriculum, developing the curriculum that in response to emergencies. So this is the priority that our government and the Minister of Education is being focused on. And when it comes to employment, yes, now I think all our youths, we need to re-skill them. We need to educate them. We need to skill them to have the self-employment programs. No, so then once they are trained, then we encourage them to have their small college, get into their as entrepreneur, develop their own programs, initiatives, and ideas. In that way, the government should come here as a guaranteed scheme, because even if the youth, even if they have the very innovative, the bright idea, they cannot implement because of the lack of funding. So the state intervention is required here. So these are some of the areas that the greater initiatives that the royal government of Bhutan has taken here in Bhutan. So when it comes to education and employment, now we really look forward with these new interventions from the government side as well. Thank you.
Yeah, thank you. Anything to add on, Igor?
Oh yeah, yes. Hello, Gladys. How are you? This is very interesting question. I think I can remark 3 points about your question. The number one is about the future of the work. We in 2 years ago, we are discussing a lot about the future of the work, the changes in the work we are seeing in the long-term time, like the demographic changes, like the participation of the woman, like the migrants, like the elderly working population, the changes about the content of the work in terms of the kind of contract in the outsourcing, downsizing, outplacement, and the contracting, and the changes in the technology. This is changing the game about the laboral work. And these changes are in some cases are impulsed by the pandemic, and in other cases are impacting to probably in the technological area, the changes are accelerating by the pandemic, and the professional competence are changing about the pandemic. In more of the case, we are talking about the collaboration in teleworking, in telepresence. I was seeing the most recent launching of Microsoft in Mesh. That is a telepresence in an hologram program for perform video conferences, and this kind of a conversation probably in the future we can maintain by holograms. It's very interesting. So it is an impulsive factor by the pandemic. So, but by other side is the education. You are pointing about a very important issue. Education is changing. Is one of the more changing disciplines and areas of the development of the human being. The education, we are now making a lot of questions about the quality of education in this time of changes. If or students are very forming in these areas by the hybrid system of education, and what is the quality of the education that are receiving by this new system of education. What we are in a process of essay, because this extensive kind of education by online education is under is in a laboratory making some test about strategies to make the competent professional competency. At the other side is the health in all the policies. This is very important because we are taking the conscious about the health is very important for the economic growth. And WHO is proposing an initiative named Health in All Policies to incorporate the health perspective in all the development of the public policies.
Yeah, thank you, Igor. So we have already crossed the time allocated for the webinar. I have one quick questions and we'll end the Q&A session. Maybe one of the speaker can answer these questions. What could be the role of international cooperations in achieving SDGs in relation to the SDGs 17, which is partnership for goal? A quick answer would be very appreciative. What could be the role of international cooperations maybe to the low resource setting countries in achieving SDGs?
To make it quick from my side,
Yeah.
I would say, yeah, first of all, fair and equitable access to the vaccines
Yep.
regarding patents and the distribution, which needs budgeting and yeah, cooperation, like you said. I think, yeah, I highlighted a lot of these points in my slides. So I think if you go back to them, which will be available online, you can find a lot of points.
Yeah, thank you. One more, any points to add on? Few points. Yeah.
I just quickly want to add here is, like Albert rightly pointed out about the global attention and the global leadership need to more focus on the vaccine distributions. And we really see that, we already see that most of the poor countries cannot afford to get the right proportion of vaccines for their citizens. In that way, I think the richer countries, they really need to share the funding in the form of loans, in the form of grants as well. So financial support for the least developed countries really needed to be looked into. And then vaccine distributions, I think, is a very risky, is a very fragile area at the package, so which really need to be handled both at the political level and both at the executive and at the national level. And the one thing that I want to hear is about after receiving the vaccines and the distribution of vaccines, to sustain here on from the negative impact of pandemic, we really need to go for or look for about the close partnership between the government, CSOs, NGOs, private sectors, youth, volunteer groups, and all this. We really need to have coordinated effort when it comes to vaccine distributions and the response system. Thank you so much.
Thank you. Igor, last point from you, and then we'll end the Q&A session.
Okay, I subscribe to Albert and Turchin speech about the need of equity and vaccine distribution. This is a big issue, but inequity is a character of the world. I see is to talk about equity is very difficult in practical terms, because the economic differences, the logistical differences, and in my case, in Latin America, ideological difference are marking a difference between the distribution of the vaccines from some provider or other. It is a real challenge to assure the equity and vaccine distribution. and in the term of the time get an effective vaccination process could be many times. Maybe some countries in Latin America or South Asia or Africa need 3, 4, or 5 years to complete a process of a total vaccination of the population. This is the real thing we are estimating now. But we have enormous challenges about that, and to planify the process of the prevention and the treatment of the disease in the lab. We are planning the vaccination because it is a very challenging situation.
Yeah. Thank you, Igor, and all the presenters for a very insightful presentation and very active discussion. Thanks to all the audience for sharing their questions and for the active attention. With this, we will end the Q&A session. And before we wrap up the session, I would like to share the information on our upcoming webinars. So we have a series of webinar in the coming months. On March 25, we will be organizing webinar on topic climate change and health, and similarly in April, May, and June in different topics. So the announcement will be made in our CIH website, and we'll also circulate the emails to all the registered participants in the upcoming webinars. So with this, we come to the end of this webinar. All the PowerPoint slides and the webinar recording will be available in the CIH website. Thank you all the speakers, and thank you all the One Health Knowledge Café team, and thank you everyone for your attention and for attending the webinar. With this, I officially announce the end of this webinar. Thank you.
Thank you so much. Good night.
Good night.
Thanks.